Hot flashes are one of the most annoying side effects of menopause, and people have tried all kinds of things to try to relieve hot flashes because it's so obnoxious for women. Estrogen is by far the medication that works the best for hot flashes, but some women don't want to take estrogen or aren't able to take estrogen. There are some other prescription medications that have also been shown to be effective against hot flashes, such as clonidine, certain antidepressants, or even gabapentine. However, some women want to use something that's non-pharmaceutical or at least over-the-counter to help combat the hot flashes. And there are a wide range of things that have been tried over the years to help relieve hot flashes. And honestly, if you ask women, they'll swear by this treatment or that treatment. Interestingly, though, a lot of these treatments have pretty reasonable studies to look to see if they're more effective than placebo. Now, placebo is when you take a sugar pill, but you think it's active. And it turns out that placebos have about a 20 to 25% benefit. In other words, if you take something and believe it will work, even if it's just a sugar pill, there's a reasonable chance that it might help you. And so you really need to do studies that are looked at against placebo to see if they're better than just a sugar pill. And there actually have been a lot of studies for many of these over-the-counter or alternative treatments or non-pharmaceutical treatments for hot flashes. And unfortunately, none of them have performed better than placebo. The only exception to that is vitamin E, which did perform slightly better than placebo. It was statistically significant, but not clinically significant. So although from a statistical point of view, it worked better than placebo for reducing hot flashes, vitamin E didn't really make enough of a difference to make a difference for most women that take it. But that is the one thing that has been shown to beat placebo. That's a non-prescription medication. There are a lot of other things that have been tried, and some of the popular things are so-called phytoestrogens, which are plant-based estrogens, things like increasing soy in your diet, or taking many of these supplements that have these phytoestrogens in them. There have been a lot of placebo-controlled studies which have shown that they are not more effective than placebo. Basically, they don't work. Black cohosh is perhaps one of the most popular herbal remedies for hot flashes, and there have been several placebo-controlled trials, and unfortunately, the black cohosh has not outperformed placebo against hot flashes either. So basically, that doesn't work as well. Another type of herbal is an isoflavonoid, and those also have not been shown to be better than placebo. They don't help reduce hot flashes either. People have done placebo trials against acupuncture, magnet therapy, and neither of those beat placebo in reducing hot flashes. Another common remedy for hot flashes is evening primrose oil, and there have been studies looking at evening primrose oil. Unfortunately, that doesn't beat placebo either. So, bad news, but none of the over-the-counter remedies, none of the herbal remedies, or none of the alternative treatments have been shown to be better than a sugar pill in reducing hot flashes in women. My advice is if something is not expensive, if it's not dangerous, and you think that it helps you, by all means take it. But the truth is, from a purely scientific statistical point of view, in all the studies that have looked, none of these remedies have been better than placebo at reducing hot flashes.